These video modules have been created at the Pacific Institute of Languages, Arts and Translation to help trainers and translators in the Pacific who want to learn more about their languages and linguistics.
In this video, we're going to introduce you to the concepts of actors and patients and look at the order they normally occur in within sentences in languages. First, I want you to imagine a situation involving a pig happily standing in the village, unaware that a rather mean dog is coming towards it. In this situation, the dog was the one who did something. He bit the pig, so he is called the actor. The pig, on the other hand, was the one who something happened to, so the pig is called the patient in this situation. The dog is the actor, and the pig is the patient in whatever language we use to talk about this situation. Think for a moment how you would say what happened in any language that you know. Now let's think about English. In English, we might describe what happened in this situation by saying, "The dog bit the pig." In this sentence, the words "the dog" represent the actor, and the words "the pig" represent the patient. We also use the word bit, which is a verb, in the middle, to say what the actor did to the patient. In Tok Pisin, one of the official languages of Papua New Guinea, the sentence sounds fairly similar. We say, "Doki kaikaim pig." Again, dok is the actor, pig is the patient, and kaikaim is the verb. The order of the different parts is once again actor, verb, patient. Arap Lokep is a language spoken on Long Island in Madang province. The way we describe this situation, gaunu ikana ga, sounds very different to English and Tok Pisin, but the order is still the same. First we have the actor, gaunu, dog, then the verb, ikana, bit, and finally the patient, ga, or pig. Notice that in all of these sentences in English, Tok Pisin and Arap Lokep, the order of the parts is the same. The actor comes first, and then the verb, and then the patient. We can say that the order is AVP. Sometimes people say the order is SVO, subject, verb, object. In each of these languages, the order of the parts tells us how to understand the sentence. It tells us what the sentence means. For example, in English, if we leave the verb in the same place, but switch the order of the other words around and put the pig at the beginning and the dog at the end, the sentence means something different. The pig bit the dog. Many other languages have different orders for the parts in their sentences. For example, in Makeo, an Austronesian language from Central Province in Papua New Guinea, the actor is still usually at the beginning, but the patient comes before the verb. This actor-patient-verb order is a very common order for Austronesian languages in the southeast of Papua New Guinea. This order is also very common in almost all the non-Austronesian or Papuan languages throughout the rest of New Guinea, particularly in the family called Trans-New Guinea languages. For example, in Mamanda, in the Finisterre Mountains of Morobe province, the actor comes first, then the patient, and then the verb. We say that languages like Makeo and Mamanda, and many other languages in Papua New Guinea, have the normal order actor, patient, verb, or APV. More commonly, these languages are called SOV languages, because the subject comes before the object, and the verb is usually at the end. In some languages, the verb even comes at the beginning of many sentences, as in Hebrew stories, where the verb usually comes first, followed by the actor, and then the patient. So this sentence says, "Vayenashech hakelev et hachazir." We can show the typical orders for different languages in the Pacific by plotting them on the map. First, the blue spots are the languages that have the normal order of actor-patient-verb, like Makeo and Mamanda. You can see that most of the languages on the mainland of New Guinea have this order. Languages with red dots, on the other hand, have the same order as English and Arab Lokep. That is, actor, verb, patient. You can see there are many languages like this on the north coast of New Guinea and on the Pacific Islands. Other languages, shown by grey dots, do not have a particular order for the actor, verb and patient. They use other methods to help people know who did something and who the thing happened to. Finally, there are some languages in the Pacific that have other orders, such as all the languages shown here in yellow, which have the verb at the beginning. We've been looking at this in some detail because this order of actor, verb and patient can give us a clue to lots of other patterns that we might find in a language. At every level of the language, from phrases to sentences to paragraphs to whole stories, we often see similar patterns. The main thing at each level is usually at the end if the word order is APV, where the main thing is the verb at the end. For example, you would normally say something like the house in instead of in the house in these languages. And usually it would be more natural to say something like, in order to buy soap, I went to town, rather than I went to town in order to buy soap. On the other hand, if the word order in the clause is actor, verb, patient, the main thing in phrases, sentences, paragraphs and stories is often at or near the beginning. Typically people say in the house rather than the house in these languages. And usually it is more normal to say I went to town to buy soap rather than to buy soap I went to town. So, here is a final translation tip. When you are translating, it is very important to use the natural order of the language you are translating into. It is very easy to just copy the order of the language from which you are translating, but if you do this, the meaning may not be clear. Remember to think, and use the correct order that sounds natural in the language you are translating into.